I will start now. Greetings, eh? This is Nurse Magdalene, eh? And we are going to be talking about labor. We are going to say one or two things about labor, one or two, so that you learn one or two lessons from labor. Magdalene, please, eh? Um, you say you have something to tell pregnant women that are pregnant women about labor. You want to have some information to tell them so
Yes.
that they will benefit from. So can you go ahead now?
Okay. In terms when you are fully, like when you're in your third trimester, 9 months, when your labor have started, you are not supposed to push, like, because some women, when they don't feel
You are
like
talking about during labor now.
Yes,
When the
during
woman
labor.
is in labor, she
Yes,
is on the table
Yes,
in the
table.
theater
Yes,
or
yes.
the labor room.
Yes.
So she's not supposed to push.
Yes.
So
You're not supposed to push until you are 10 cm dilated, like your cervix is fully open,
Yes.
and the nurse tells you to push.
Yes.
Don't push because it can cause tear, and
Okay.
the tear is not funny. It can give you like cervical tear, vaginal tear, which can cause bleeding.
But I think you should also take it easy because the people that follow this page, they can become scared because of the way you are saying it. So also encourage them. So what Nurse Madeleine is trying to say is that until you are told to push, right? Until you are told to push, do not push. So that you are not going to have tear.
Yes.
Unnecessary tear.
Yes.
And only push when the doctor or the nurse, especially the nurse or midwife, tell you, it is time to push, and until you are 10 cm dilated, that's when you should push.
Yes, I'm not trying to scare anyone. I just want you to know the things, so you don't, before you go, you are prepared already and know some kind of things. Thank you.
But don't thank anybody yet, so we are not done. Another thing is, which other thing do you think they can learn from?
Okay.
What about preparing for labor when it's getting to the time of labor, when they are almost is getting to their due date? The things they need to carry along, and even to carry their phones, and to prepare themselves for labor. Labor should not just come to them, to you as a pregnant woman, because just suddenly. It should not come suddenly. It's something you can prepare for.
Yes.
You knowing that it's getting to the time that I will deliver. Then that's not the time you will now be traveling long distance. That's not the time you will now be going long distance. You should be close to the hospital. It's also recommended that you should register
close by.
Close by. You should register close to the hospital so that you can always reach the hospital in time, because labor can come at any time.
Yes.
When you are at 37 weeks, labor can be in the morning, it can be early hours of the morning, it can be in the midnight. So you must still go back to the hospital, and also make sure that you register in a hospital that run 24-hour service.
Yes.
Because some hospital close by 4, just like you close in your civil service work by 4, they will close and lock shop to come the next day. So the hospital you registered in that you want to deliver must be available 24 hours. So that you will not come to where you want to deliver, they tell you that nobody is around. In fact, you see that the door is locked. That's it. So I know you have more information to say about that.
Okay, like some things that you need to carry along. Don't forget your delivery mat is very important.
Okay.
Though some hospitals have it, but you just need to have it in case.
So like how many should they have?
At least 2, 3.
Yes,
to be on the safe side.
So that after you have delivered your pad, yes.
Your pad, then your baby things.
Okay.
Don't miss that. Because some people might come, they're like, hey, baby clothes, they come for road. No.
Yes, so everything should be ready in a pack. Yes.
And there are some signs you see during labor. You don't need to panic. Just relax. Like you be seeing some discharge. Some people think it's infection. No, it's not infection. It's normal. Yes. So you don't need to panic.
The one they call show.
Yes. It looks like cancer.
Yes, it look like cancer, yes.
You don't need to panic. You just need to come to your facility where you've registered. Then let them know. And secondly, try and do some exercise when it's close to your due dates. Yes. So in case it makes things easier for both of us.
Okay, and I think I agree with that. Walk around, move around the house. Nobody says you should go to gym and start carrying heavy weight like Mike Tyson, no. And nobody said that. Just move around the house, walk around the house, do one or two sit-ups. Just move your leg, Sha. Just move your leg. That will help with delivery. Uh-huh. Don't be stiff. And whatever they say you should, any instruction they tell you, follow it. Especially that when to push is very important, because most of the tears most women have, pregnant women have during labor is because they did not follow instruction. They started pushing when it was not time to push. They would just be pushing. Some will just gather their strength and say, let me push this baby out once. It's not, you can't just push baby out once, so it's a gradual process. I hope you have learned one or two from this conversation. Is there any other thing we need to say?
I think we've said most everything.
Then after delivery, you must stay behind so that you must wait. Don't be in a hurry so that yes, because some of you, once you deliver, you notice that there is no tear. You want to go home. You want to go and inform your people that you have no. You must be around at least for hours or even a day for observation, so that they'll check you, make sure that all the placenta is out of your body. Because if they don't deliver, because you deliver twice during labor. First, you will deliver the baby. Second, you will deliver the placenta. Very important. After you deliver the baby, the placenta must come and let the doctor or the nurse, the midwife, check whether all parts of the placenta is out. So let them also check inside you to see whether you have tear, so that no tear will be missed, so that you will not go home and run back again that you are bleeding. So let everything. They will give you some medication like oxytocin, misoprostol to help your womb contract. This is a labor education series we are giving you now to help your womb contract, so that your womb will contract properly, so that you will not be bleeding. That's why. So you don't just be in a hurry. Let the nurse check you. If there is a bleeding, they will suture it. That is, when I mean suture, I mean they will stitch it. They will sew it. They will stitch it. They will stitch every bleed. Don't worry. When they are stitching it, they will give you painkillers. They will give you injection around there, so that you will not have any pain at all. So that's how it is. So that's how it's done. No, it's not something that you'll be worried about. No. Don't panic. Don't panic. Then after you have delivered, they will another thing. Please, can you tell them about baby? Because there is this thing that they switch baby. They will now switch baby. This hear from a nurse now.
There's nothing like switching of babies. Immediately your baby comes out, they will show you that this is your baby, being female or male. They will let you know. There's nothing like.
And you even see if it's a female, you will see the gindi.
Yes.
You will see. Then if it's a boy, you will see the go as they say it. They will show. They will even ask you, "Where till you born?"
Yes.
Nobody is too educated inside labor world. They will talk to you in the language you understand. Madam, see your baby. Where till you born? Where till you they see? Now go you they see, or na gindi you they see. Which one you they see? They will ask you. You will now mention it, because that's it. Then if you probably you are unconscious, because some women go not during they don't go unconscious during labor, but something happened to them. Maybe they came in, maybe all those women that have preeclampsia or something happened, they did not come to the hospital on time. As when they did CS for them, and they were put to sleep. They were sleeping after labor or after the baby is out. Your relative will just be at the door of the labor room. They will call your relative in to come and see the baby. So those story of baby switch, they now carry my baby. You have to be careful about that. You have to be careful.
Nigerian movie that I do have.
Say it so that they will hear.
It's Nigerian movie that I do have.
I've never seen it in my life. Now only for Nollywood that they see them. Nollywood has a way of trying to paint our society bad. They paint our culture bad. They paint our kings as bad. Our kings are always bad in Nollywood. They are always carrying people's wife, carrying people's land. my king does not do that. I don't think that. I don't. Does your king do that?
Not at all.
So, but Hollywood will always show that our kings are bad. We have one uncle that is wicked. Our uncles are always wicked. That's what Nollywood portray. But it's not like that in real life. Some of you were raised by your uncles.
Yes.
Some of your uncles sent you to school. Some of your uncles raised you as their own children. But Nollywood portray our uncle as always doing diabolical things, carrying charms, and wicked uncle. We always have wicked uncle. My uncles are not wicked. So that's it. Is there anything we need to? Is there anything we still need to talk to them?
I think we've said enough.
What about breast? Okay, that is labor. Maybe when next we have this session again, we'll talk about breastfeeding. Maybe how to, because some women, even after they deliver, the breast milk will not be coming out. That one is another problem on its own. So you can thank them. So there's a way I do it too. There's a way I do it. I say thank you and bye bye.
Okay, thank you, bye bye.
Yes, that's my trademark. So if you don't say that, most of the people watching this will not believe that they are hearing my voice. So it must be thank you and bye bye.
Okay. Thank you and bye bye.
Thank you and bye bye.